Hello everyone, I'm Sherry. Masturbation is a behavior that many people may have experienced during their growth. Moderate masturbation generally does not cause serious harm to the body, but if masturbation is performed for a long time and excessively, a series of obvious changes will occur in the body. Understanding these changes will help people correctly understand masturbation behavior and establish a healthy life concept. From the perspective of the reproductive system, frequent masturbation will first have an adverse effect on the prostate. During masturbation, the prostate will be repeatedly congested. If this continues for a long time, it is easy to cause disorders in the normal metabolism and secretion function of the prostate, increasing the risk of prostatitis. When prostatitis attacks, there will be abnormal urination symptoms, such as frequent urination, urgency, pain, and incomplete urination, and may also be accompanied by discomfort such as swelling and pain in the perineum and lower abdomen. For male reproductive function, excessive masturbation may affect sperm quality. Frequent masturbation keeps the reproductive system in an excited state for a long time, and the hormone secretion is unbalanced, which will lead to a decrease in sperm count and vitality, affecting fertility. Moreover, prostate problems caused by excessive masturbation will also cause abnormal secretion of prostatic fluid, and prostatic fluid is an important component of semen. Changes in its quality will directly affect the liquefaction of semen and the activity of sperm, and ultimately have a negative impact on reproductive health. In terms of sexual function, long-term masturbation often leads to sexual dysfunction. In the early stage, the ejaculation threshold may be lowered. That is, it is easy to ejaculate too early, that is, premature ejaculation. This is because the pursuit of quick pleasure during masturbation changes the neural pattern of ejaculation reflex, making it difficult to control the ejaculation time in normal sexual life. As masturbation continues, erectile dysfunction may also occur. Excessive masturbation causes repeated congestion of the reproductive organs, and the blood vessels and nerves are in a state of tension for a long time, which can easily cause damage to the genital cavernous blood vessels and nerve conduction dysfunction, making it difficult for the genitals to have erections, weak erections, or shortened erection, duration, making it impossible to have normal sexual life smoothly. The nervous system will also be affected by excessive masturbation. The brain is highly excited during masturbation, and long-term and frequent masturbation will keep the nervous system in a state of tension and fatigue. This will lead to symptoms such as memory loss, lack of concentration, insomnia, and dreaminess. In study and work, it is difficult to concentrate, affecting study and work efficiency. At the same time, insomnia will further aggravate physical fatigue and mental depression, forming a vicious circle. The overall state of the body will also deteriorate due to constant masturbation. Excessive masturbation consumes a lot of physical strength and energy, which will make people feel weak in the waist and knees, weak in the body, and easily fatigued. In addition, the body's immunity will also decrease, and the resistance to external pathogens will be weakened, making it easier to catch colds, respiratory infections, and other diseases. According to Chinese medicine theory, excessive masturbation will deplete kidney essence, lead to kidney deficiency, and cause symptoms such as dizziness, tinnitus, chills, and night sweats, affecting the overall health of the body. I met a young man in the outpatient clinic who was very distressed recently. He is energetic and always has the habit of masturbating on weekdays. He has not felt any discomfort since he became an adult. But in the past 6 months, he found that when he masturbated, he always ejaculated too quickly. His body was satisfied, but his heart was still very empty. He was worried that he had premature ejaculation. He was very depressed recently. His appetite became worse, and he often suffered from insomnia. Finally, he decided to go to the hospital for treatment. The doctor asked about the situation in detail and learned that he had no real experience of male and female sex. He comforted him that this situation was not considered premature ejaculation. According to the symptoms, it was liver depression, and some Chinese medicine treatments could be used to help improve it. The doctor also advised that the frequency of masturbation should not be too frequent. When masturbating, you can properly control the stimulation rhythm and give different stimulations, which can also help prolong the ejaculation time. After listening to the doctor, he finally dispelled his concerns. After a period of treatment, the situation has improved. Will men often use their hands to cause premature ejaculation? Masturbation is a very common way to vent sexual desire, which can bring pleasure and relieve stress. But as the frequency of masturbation increases, some men find that they are getting faster and faster, which can't help but worry. Will long-term masturbation lead to premature ejaculation? In fact, there is no direct evidence to show the relationship between the two. Premature ejaculation is generally divided into primary premature ejaculation and secondary premature ejaculation. Primary premature ejaculation occurs in the first sexual life, manifested as ejaculation within about 1 minute of contact with the vagina, poor ejaculation control, and negative emotions. Secondary premature ejaculation is that there was a normal sex life before, but now it ejaculates within 3 minutes of contact with the vagina. However, premature ejaculation cannot be judged by the length of ejaculation time, and the patient's condition needs to be considered comprehensively. Although there is no direct cause and effect between masturbation and premature ejaculation, frequent stimulation can easily form a positive feedback mechanism in the ejaculation center and produce a rapid ejaculation memory. If the following situations occur after long-term addiction to masturbation, it may mean that it has been overdone. The erectile response period of ding-ding is getting longer and longer, or it cannot stand. After multiple attempts, the ding-ding feels pain, urination is uncomfortable or secretions increase, and the whole body is tired, listless, and inattentive. What will happen to men who use their hands for a long time? Regarding this issue, the male doctor of Jung Men's Hospital said that frequent literally means that there is no limit to the number of times. If an adult male who has not reached the age of marriage does not have a normal sex life, it is normal to have 3 sperm at urea every month. Therefore, masturbating several times a month does not have a big impact on the body. But if it happens several times a week, it may affect sexual function and fertility. Excessive masturbation may bring these changes to men. 1. Affecting people's spirit. Long-term excessive masturbation is equivalent to excessive indulgence. The whole child will feel tired and unable to concentrate. Sometimes it will cause dizziness, headache, or tinnitus. It may even cause abnormal kidney function due to masturbation, to decreased libido. Excessive masturbation will affect the body's endocrine homeostasis. Once hormone secretion is affected, men will gradually lose interest in sex. Long-term masturbation will also affect testosterone secretion, causing male libido to decrease and accelerate aging. 3. Affecting memory. When masturbating, the brain will produce dopamine. People who masturbate frequently can easily release a large amount of dopamine, which will affect the normal function of the brain, especially the memory. Many people who masturbate frequently will have memory loss and even be unable to remember things normally. Doctors remind correct hands may help treat premature ejaculation. Excessive masturbation will bring a burden to the male body, but in fact, correct masturbation can relieve premature ejaculation. At present, most men have not developed a good habit of masturbation. Many people do it secretly when they are sexually conscious, and they deal with it quickly, which forms a habit over time. You should know that masturbation is the same as sexual activity. The faster the action and the greater the force, the faster you will ejaculate. If you want to prolong the time of ejaculation, you should slow down when you are about to ejaculate and constantly experience the critical point so that you can exercise your control. In addition, when faced with a constant stream of desires, how should men control it? 1. Correctly understand and properly restrain. You must have a correct understanding of sexual impulses and understand that this is a normal psychological manifestation. Don't deliberately restrain it, and don't do it casually. Just control it appropriately. 2. Divert attention. Once people become bored, they are prone to fantasies. There is no shortage of cultivating interests and hobbies in daily life so that you can focus on this to reduce fantasies about sex. 3. Watch less pornographic materials, books, movies, etc. With pornographic images will cause sexual stimulation to the brain. Therefore, watching less color materials can also help control desires. In most cases, premature ejaculation is not really a disease, and it is likely related to psychological state, physical fatigue, etc. If you casually guess that it is caused by masturbation, it will only cause psychological burden and aggravate premature ejaculation.